Hi, I'm Laura Flanders, and this is CityWorks, a production of the City University of New York School of Labor and Urban Studies and CUNY TV. Every month, CityWorks examines an aspect of the lives of working people on the job, at home, or out in the diverse city that is New York and the greater urban landscape. We have an exceptional episode for you today. Two outstanding thinkers and doers. One, a medical doctor, the other, a journalist and author, both with up-close insights into race and social justice in movement building and making the abstract real and concrete. Both in different ways are helping us unravel the power dynamics holding this nation back. How does a movement for equality take hold? They have some compelling answers to that question. Dr. Torian Easterling is the first Deputy Commissioner and Chief Equity Officer of the New York City Department of Health and Mental Hygiene. We'll speak with Dr. Easterling in the second half of today's show and hear about the landmark resolution on racism as a public health crisis that was passed by the New York City Council just months ago. But first today, I am super excited to welcome Heather McGhee. I want to suggest that Heather McGhee's new appointment as a distinguished lecturer to the School of Labor and Urban Studies at CUNY is a reason to celebrate the new year. Heather, welcome to SLU and welcome to CityWorks. We're glad to have you.
Thank you, Laura. I'm so excited to be here and here at SLU.
So let me start with the tough stuff. Your book is about our mutual interest in looking after one another as a community, and the pandemic blew that loudly into all of our lives. Since then, we've seen, well, by some estimates, officially 5.5 million dead. Others are saying as many as 20 million dead, and more wealth accrue to billionaires than ever in human history. So where's that solidarity gone? And where do we stand today in talking about what you write about, the sum of us?
Well, I think that solidarity does exist in every corner of this country. It's happening with nurses and teachers and essential workers. It's happening with neighbors who go up the stairs, 5 flights of stairs, to carry groceries for a homebound elderly neighbor. It's happening on, mutual aid networks that have cropped up all over the city and are still going strong. As so often is the case, you see so much solidarity among working and middle class folks, among communities of color, among people who go to work every day in service of the greater good. Where you don't see that solidarity is absolutely among the fat cats and the plutocrats and the bigwigs who have found a way to see the concentration of our economy, the shift online and the explosion of revenue from mom and pop stores down the street to going online and going into just a handful of coffers who've been able to exploit and price gouge and to use the pandemic to claim inflation when what they're really just doing is jacking up the price. And so not surprisingly, people who are oriented towards profit maximization are using these extraordinary circumstances to do what they do best. What we also know, though, is that what did surprise me is that for the most part, the first year of the Biden administration has seen an extraordinary amount of aid going to those who need it the most. And the US poverty rate declined to the lowest level it had been on record. And so I think it is a mixed story of government doing what's necessary, neighbors doing what's necessary, and the very wealthy still doing what they do best.
So let me ask you to unpack just a little bit further, because it has been so hammered home in the rest of our media that COVID is causing inflation. Can you talk about what is actually going on?
I mean, I think, to be honest, I think in the media, they're basically saying Biden is causing inflation. They're saying that, in fact, what's even more insidious, the sort of dominant right wing narrative that has become the mainstream narrative economically, is that too much money in the hands of people who need it the most is what's causing inflation. And that's just simply not true. And I think that people like Elizabeth Warren have really called for the FTC to really investigate what is plain and simply price gouging. There has always been the desire for people who can set their prices, to set them as high as humanly possible. There are obviously supply chain issues. There are workforce issues as people have been unwell enough, too sick to go to work, unwilling to go to work to risk their lives and the lives of their neighbors for minimum wage jobs. Right? There are real things that are happening, but there's also, and you see it in the profits of our largest corporations. There's also just plain and simple price gouging going on.
With respect to the health system in particular, we're hearing again in our money media that there's a labor shortage, that people are not showing up for work for the reasons that you allude to, that we're being told people have somehow gotten, I don't know, lazy and greedy and just want to stay home. We're at the same time hearing from, among others, nurses that they are staying away from work in caregiving because of how much they care. Can you talk about what you're seeing in healthcare specifically and how that's affecting workers across the board, and especially workers, the most vulnerable, people of color and people that work maybe not as nurses, but as other members of the medical staff?
Well, our for profit driven healthcare system has always been vastly unequal, has exploited the labor of women, of immigrant communities, particularly those that tend to come here and work in healthcare, has exploited the labor of people towards the bottom of the pay scale, and by adding so much stress, right? We have thousands of COVID deaths per day still at this moment, despite all the efforts to get our vaccination rates high. We still have thousands of COVID deaths per day. Our hospitalizations are the highest they have been since the beginning of the pandemic, because Omicron has just completely, spread like wildfire throughout many of our cities, and those for whom it hasn't yet, it is coming. That stress, that sense of burnout, of understaffing, where you have people having to quarantine because they've been exposed and been sick, and therefore you simply don't have the numbers that are needed. And then that you haven't had a real public health core surging in of support to these, especially safety net hospitals and clinics, where, because of what I call drained pool politics, the way in which governments in the United States at all level have short-changed our common needs for the public as the public has grown more diverse. You have so many areas in this country where at the start of the pandemic, there wasn't a single free ICU bed. And of course, it's only gotten worse. But ultimately, this is a moment of extraordinary worker power in this country. And whether it's home health aides striking for the safety of their patients, saying that understaffing is costing lives, and for-profit nursing homes are shortchanging and killing their patients because they're trying to price gouge and profit during the pandemic. Or it is, workers here in New York who are part of a rolling wave of registered nurses saying, we've had enough. This is simply not sustainable. This is a moment of great worker power, and you're starting to see that shift.
All right, so great worker power, I'm with you, and I'm sure our viewers are too. Let's talk about how it might be, in your view, best applied. You referred to one of the core metaphors of your book, The Sum of Us, the drained pool idea, the idea that during desegregation, a lot of communities around this country were persuaded by, others and their own instincts, to their lower instincts, to prefer to have no pool at all than one that's integrated, no swimming pool. What would be our equivalent today as we look ahead to this country? No government at all, no elections at all, no future investment at all? What's the
Oh, well, we're seeing drain pool politics all across the board. I mean, obviously, January 6th was an amazing moment of, obviously a fringe group who, according to University of Chicago research, the unifying, motivating sort of narrative behind those that were arrested on January 6th was the fear of sharing the spoils of the United States society with people of color, the fear of the so-called Great Replacement theory, the idea that as people of color become more numerous in the country than white folks are going to lose out on core rights. This is a story that they get from Fox News and OAN and all of that and Donald Trump in a sort of, hour by hour basis. So January 6th is a drain pool story. They'd rather destroy the seat of government than share it with people who might vote for a Democrat and people who are people of color. Another example of the drain pool politics that we're seeing is the way in which some of these same forces who funded the Stop the Steal movement have been funding attacks on education. The idea that they'd rather that these white political operatives are trying to convince mostly white parents that instead of having integrated history where you, I don't know, assign the Dr. King I Have a Dream speech or a children's book about Ruby Bridges or Toni Morrison's Beloved as what was at issue in the Virginia gubernatorial race, that they'd rather just ban honest education all entirely, right? And scare white parents away from the integrated public good that is public education and an education about diversity in our country's history. And so there are so many examples that you can see of this drain pool politics. Fortunately, just as January 6th was an event that the majority of the country found abhorrent, even these attacks on honest education, as they're winning in a dozen states, are still unpopular. People understand that it is deeply un-American to ban books, to burn books, to say we don't want to learn about certain history because it might make us uncomfortable.
The other big metaphor that you talk about in your book is the solidarity dividend. And you could say that we've seen a lot of solidarity dividend from all that investment that was directed to the most vulnerable during the pandemic, whether it's the Build Back Better, the Rebuild America Act, or the infrastructure investment. Much of that seems to have accrued financially, at least, to those companies that were kept in business by old people spending money. How can we see and celebrate a solidarity dividend when so much of it seems to kind of go off into a few pockets?
Well, I think that we should celebrate the wins when we have them, right? What you're referring to, I think, the most explicitly is the Paycheck Protection Act, which, gave forgivable loans to thousands, I don't know exactly how many it was in the end, but to, a lot of companies of all sizes, and the idea was that they would keep their payroll strong. And there was recent data that just showed that the vast majority of it was sort of pocketed by the corporations and not passed on to workers. That's a flaw. That's a problem. That's frankly not surprising when you have big banks meeting up with big corporations and taking government money. I'm not at all surprised. But then you have things like the child tax credit, which has been sending up to $3,600 a year per child in biweekly checks and wires to most American families with children. That has been huge. Now, obviously, there were many who wanted to make that permanent, at least extend it through the end of the pandemic, which we are not out of. And yet the resistance of some corporate Democrats has made that not possible so far. But as I said before, we did see child poverty decline in half.
And that has, presumably, that stimulus bill, that spending has kept the economy going and going quite healthily for a lot of
That's right. I mean, job growth, GDP growth has hit a number of different records, and that's because for the first time in my lifetime, I will say, politically, we had a government that was not afraid to do what governments do best, which is step in a crisis and fund the public good. That's been extremely important, and it has saved the American economy.
And we've seen that it worked. It worked to keep people out of poverty. It worked to keep children and others fed. It worked to keep, as I mentioned, the economy going on, even if some people made more money out of it than others. What do we do next? What's your next sort of great expression of solidarity that you're looking for, and that people in unions and not in unions can be part of?
Well, I think we need to obviously have labor law reform in this country. I think that we should not get the sense that we have to give up because Joe Manchin and Kristen Sinema don't want to build back better or preserve the freedom to vote in this country. There are still so many things that the Biden administration and the Democratic majority could do in Congress to build on the momentum of this moment of worker power. There is no reason why we shouldn't be passing major labor law reform. At the state and local level, there's momentum right now to do major rent control reform in New York. We've got the momentum behind canceling student debt, right? We've gone nearly 2 years without student loan payments, and people have been, the government has been just fine, and 86% of student borrowers and graduate borrowers are not ready to start repaying the government and would rather be spending that money, saving it, spending it on their families, spending it on their careers, and that's the right thing to do because the experiment of the debt for diploma system was a quintessential example of drain pool politics, and we need to move away from it entirely if we're going to have a future middle class that is diverse and thriving and looks like America.
I can see that we have learned that some sorts of solidarity really work. Now let's practice that belief in our actions. Thank you so much, Heather. I appreciate it. We have work to do, but your book is a big inspiration to go out and do it and to think as broadly and widely as we can of that sense of us. We need one another and we need you. And we're glad you're at SLU. Thanks for coming.
Thanks so much, Laura.
The CUNY School of Labor and Urban Studies is the 25th and newest school under the CUNY umbrella. Dedicated to public service and social justice, the CUNY School of Labor and Urban Studies offers undergraduate and graduate degrees in the areas of labor studies and urban studies, and certificate programs in labor relations, public administration and public policy, healthcare policy and administration, and community leadership. We pride ourselves on being an institution that brings together activists and academics. Find out more at slu.cuny.edu.
We're back with Dr. Torian Easterling, the first Deputy Commissioner and Chief Equity Officer of the New York City Department of Health and Mental Hygiene. Dr. Easterling, welcome to the program. First off, you have had a long and distinguished career in this area. What led you to want to jump into this position at this particular moment?
Well, first, let me just say thank you, Laura, for having me today. It is an honor to be joining you. Just to get to your first question, what we've already known about the impacts of racism on health outcomes. I mean, this has been studied for decades. And as a physician, as a family doctor, as a public health physician, I know that I have a unique responsibility to not only look at the individual outcomes that plague our communities, but also the population level. And there are ways in which we can talk about health in a much more broader way.
So is that what the Chief Equity Officer is going to be doing at the Department of Health?
Very much so. Not just looking at population levels, but what can we do to close the gap around racial inequities?
So one of the things that you have already done is to get past a historic resolution. It's called the Resolution of the Board of Health declaring racism a public health crisis. First off, why is this so historic? And what does that mean to be the first to pass such a thing as a city health department?
Absolutely, really good question. Well, we've already made, as an agency, we've made a declaration before the passing of this resolution. We actually made the formal declaration in June of 2020, squarely in the middle of the uprisings that were happening after the murder of George Floyd. But what we wanted to do is tie that declaration with some commitments. And that's what makes this really important. As a large public health agency, we are saying that we want to be held accountable for the ways in which we can dismantle structural racism, as we know that these are leading causes of why we see inequities in health outcomes.
Well, let's talk about that. I mean, one of the things that strikes me is we have at the federal level, particularly in the courts, this idea that racism is something you have to prove. You have to prove intent. You have to prove that a person is acting in a racist way. And that's proven very difficult to do. You're taking an entirely different approach, which is looking at how the practices of health provision in the city do or don't combat racism. You're calling for anti-racist practice. What does that look like in flesh and bones?
When we begin to look at our ability as a public health agency, we know that our tools using our data, because science and data really informs the way that we can direct our public health resources. So whether we're talking about programs or we're thinking about our policies or thinking about funding, there are ways in which we direct those funding. And over time, we have been able to look at neighborhoods in New York City. We have talked about that your zip code should not really determine your health status, but that's the reality here in New York City. So when you look at places like Brownsville and Brooklyn, or East Harlem and Manhattan, or even the South Bronx, and you can look at hypertension rates, diabetes prevalence, or even rent burden, the same pattern shows up. And so that means that we need to be able to direct our resources, our funding, and our staff into those neighborhoods to really work with community members and advocates and think about ways that we can disaggregate our data. And our resolution and declaration really calls for disaggregation of data to look at race, place, and age so we can better direct our resources.
We're going to talk about data more in just a second, but looking at the resolution, the whereas clause is often sort of, I don't know, bureaucratic preamble, but in your case, it is chilling data in those whereas clauses in this resolution. The pandemic impacts, the disproportionate impacts that are mentioned in the resolution are pretty damning, up to and including life expectancy declines for African American men especially, but African Americans in general, massively outpacing everybody else.
Yeah, and we're still seeing those same inequities today. And so you just talked about during wave one, March, April 2020, where we saw hospitalizations and deaths much higher among Black and Brown New Yorkers, 2 to 3 times higher than other race ethnicities. And over the course of this pandemic, we've had 4 waves where we surged in cases. And even right now, we continue to see inequities around hospitalizations for Black New Yorkers. This is on our website right now. When you look at our weekly cases by vaccination rates, by age, race, and ethnicity, you start to see these inequities. And so again, what shows up is that these are longstanding issues. We have to continue to remain committed, and silence is not an option.
You have also just been part of launching a coalition that is called the Coalition to Confront Racism in Medical Algorithms. And that, it seems to me, is a part of this anti-racist practice that you're trying to launch, that you are launching in the health department. Can you give us some sense of what was the problem there with medical algorithms and why this change is so important?
What we wanted to do was really begin to look at ways in which clinical algorithms are using race. And we know that race, when used inappropriately, really makes it very difficult to give quality care to individuals. I mean, this is data that has shown up when you talk about pain scales, when you're thinking about how individuals who are receiving treatment for hypertension. And we've even seen this in maternal care as well. To make it just to help me if I understand how this works, what I'm imagining when you're talking about algorithms is you literally have different numbers put in for people of different races based on, typical practice. So if people typically come in sicker, maybe with kidney disease or hypertension when they're African American, that by the algorithm is kind of considered the norm, even if it shouldn't be the norm or isn't the norm for other races. Yeah, that's absolutely right. And so when you're thinking about an algorithm, you're thinking about what are those criteria that could help determine the type of treatment or the type of care that you want to deliver. And if merely your race is part of that algorithm, then it does not account for the context of how structural racism shows up in medical care.
So this is, to me, just one example of how the resolution is going to be implemented. People are going to be hearing more about this. We just heard from Heather McGhee talking about the sum of us, and why racist approaches to how we organize society aren't good for African Americans, for sure, and other people of color, but also aren't good for the rest of us either. That's the case she's making. How would you make this case in relation to health in New York City?
Yeah, absolutely. And we certainly agree with Heather McGhee. We see that the work of our anti-racism public health practice of advancing of an equity agenda is better for everyone. When we think about ensuring that we are improving the health of all New Yorkers, that means closing the gap, because then there's going to be cost savings on our hospital. we're going to be thinking better about how we're delivering our services in neighborhoods. And so it's really important that we think about the long term, what this means. And we've seen this during this pandemic. Our healthcare systems have been overrun, and particularly because people are sicker. And when that is showing up, particularly because of these racial inequities, then we need to think about how our infrastructure can better support individuals and neighborhoods.
Last question, Dr. Easterling. If people want to know more about this resolution and just why it's historic and why they should feel extra proud to be New Yorkers in face of it, where can they go to get more information, to maybe read the resolution itself and take it on board?
Well, one, I would encourage all New Yorkers to come onto our website, nyc.gov/health. We have the resolution laid out there. And certainly, I think the other part that is really important, all of our community health profiles, so all 58 community districts have data on health, on social indicators, educational indicators. Take that data, speak to your elected officials. These are ways in which we can continue the conversation. We can address them together.
Excellent. Thank you for that. Appreciate it. I've been joined by Dr. Torian Easterling. You can find out more at our website about this historic resolution. And if you have comments or questions about this episode of CityWorks, you can email us. That's cityworks@slu.cuny.edu. For CityWorks, I'm Laura Flanders.